Good morning, everyone. This is Mark Solomon, your financial guide for special needs families. How are you this morning? I hope you're doing well. We're doing well here. We're expecting some weather to come in here. Fall has finally gotten here. We've gotten through some days of mid to upper 80s, and now it's dropping. And we're looking at several days of rain here, getting a couple of inches, which is awesome because that means we're going to get more snowpack in the mountains, which will continue the cycle of more water than we know what to do with, even if the state doesn't say so. Anyway, moving on. I hope you guys are having a great day. Look, it's we haven't been here for a couple of weeks. We've been doing transition stuff, but we've got some interesting information that I think would be really valuable for those of you who are thinking about how to take care of your child down the road into the future with medical benefits. And also those of you who have adult children who are dependent upon benefits and are looking for and understanding all the medical benefits possible. So we're going to go on with that. Today, we're basically just calling this how to understand what we call Medi. That is Medicaid, Medicare together, how you can do that. And in this case, also Medi-Cal for Californians and Medicare together, Medi, and how that works and who can get it and when. Okay, so let's get started. This is Mark Solomon, your financial guide for special needs families, bringing you simple ideas and strategies on how to lower your financial pressures today so you can get back to what's most important, taking care of your family. So I have this page right here. It's just a couple of paragraphs. I'm just going to read it down. It's not too technical, but it's straightforward in the explanation of Medi-Cal, Medicaid, and Medicare, and the tweak about who can get both and how. Okay, so Medicaid and Medicare. Medicaid is a healthcare program for people with limited income and resources. In most states, children who get SSI payments can receive Medicaid coverage, and in some cases, this comes automatically with SSI eligibility. So that means if your child has SSI, Medicaid, Medi-Cal it's an automatic. Okay, depending on what state, there's different ways to access this or get it, but it's automatic regardless of your income if your child's a minor. If your child's not a minor and they're on SSI, they get it anyway because it has nothing to do with your income, it has to do with their income. And if your situation is such that your child is capable of working and there's an income situation there and you're not sure if you're qualified because of your SSI benefit, how it works, just set a complimentary consultation and we'll talk about it, or ask a question and we'll be more than happy to answer you through email or through messages. Okay. All right. So in other states, you might sign up for it. Some children, that is Medicaid. Some children can get Medicaid coverage even if they aren't eligible for SSIs, which we just said. Check with your state Medicaid agency or your state or county social services office for more information. That's what we were just saying. Medicare is a federal health insurance program for people age 65 or older and for people who have been getting SSDI for the last 2 years. SSDI is also the DAC. Same thing. SSDI, DAC, same benefit, just two different names. Gee, isn't that wonderfully confusing? Anyway, but don't be confused. DAC, SSDI, same thing, okay? But you have to have that benefit for at least 24 months, okay? There are two exceptions to this rule. Your DAC can get Medicare sooner than the 24 months, excuse me, if they have one of two things. One is end-stage renal disease. That means permanent kidney failure, requiring a kidney transplant or maintenance dialysis. That means they're getting dialysis or they're on the list to get a kidney transplant, right? Or Lou Gehrig's disease, which is ALS. Okay. So having said that, quick story, my wife has Medi. And that's based on the fact that she has Medi-Cal because she has Medicare and she's disabled and she's under the age of 65. So her disability and the fact that she's able to have Medicare and she's disabled, she was able to get Medi-Cal and Medicare together, Medi. So they both end up helping pay for her medical expenses. Medicare pays for all of her upfront medical expenses, her premium, and some of her benefits like what is it, Suzanne? Prescriptions and copays. And Medi-Cal or Medicaid picks up the difference that it doesn't pay for. Okay? It's basically they work hand in hand to cover as completely as possible. Your situation may be slightly different, but based on the fact that she's disabled, has Medicare first because she was disabled physically, not like with autism or cerebral palsy, something that she had when she was younger. It's something that she got later from having surgery and becoming a double amputee. But she got it by getting Medicare first, then was able to add Medicaid or Medi-Cal in this case. So she has both. So for your situation, generally, if your child is an adult and receiving SSDI or DAC benefit, they don't have to be 65. They can be over the age of majority. I believe in some cases, can they be a minor, Suzanne? I don't think they can be a minor. I'll have to double check that. But if at least at the age of majority, 18 or over, they can be receiving SSDI on top of their SSI and or the DAC, which is the same as SSDI. We're just going to use DAC so we don't get confused. So if your child is on the DAC, right, then they are eligible after 24 months in the 25th month for Medicare, and they already have Medicaid. So now they are qualified for Medi. They'll have both. Okay. And the good news about that is that it's going to further help them be more stable in their medical expenses into infinitum, even when you're not here. So outside of saving in an Enable account and outside of saving and putting assets away in a special needs trust, third party special needs trust, you can further be more confident that they're going to have full coverage medically or most coverage medically because they can have Medi-Cal, Medicaid, and or Medicare together. So the requirements are for someone who's disabled is to just have the DAC on top of their SSI. What is it? Eligibility. Okay. That will, after 24 months of getting the DAC, being eligible as disabled, can get Medicare on top of their Medicaid. Okay. So it's pretty straightforward and simple. There's not much more to talk about. Now, when your state is different on accessing it, applying for it, what it covers, how it works, it all fluctuates depending on your state and how the reimbursement from the federal government is in regard to benefits in your state. They're all different. And yes, states get reimbursed for upfront medical costs or benefits that the state puts forth by the federal government, depending on what deal has been cut with your state and the federal government. In California, California gets away with only having to pay out in certain benefits only after reimbursement 30 or 35%. The rest is coming from the federal government. So that's why you've got to be following these federal government guidelines because the federal government's ponying up the money for it, right? Okay, so just remember, if your child is at least of age of majority, and I can also check if they're a minor, and they're on the DAC, the disabled adult child benefit, because you and or your spouse is taking their Social Security benefit, and then they can receive that benefit. And even if it eclipses their SSI and they no longer have SSI, that still doesn't mean they're not SSI eligible or defined as an SSI eligible person. Therefore, they can still get the DAC and still get Medi-Cal or Medicaid and Medicare. I hope that makes sense to you. I hope it's valuable. It's simple and straightforward. The DAC equals after 24 months in most typical situations, applying and be able to receive Medicare on top of your Medicaid benefits. Okay. There might be some questions you may have in regard to that. Please put them down below. Okay. If you need consultation, let us know and we can send you our link and we can have a further conversation about it because your situation may be slightly specific or you may have detailed questions you need answers to based on your situation. Everybody's situation different. There are nuances. So don't be afraid to ask questions. We'd be more than happy to answer them as best as we can. So thank you so much. This has been Mark Solomon, your financial guide for special needs families, bringing you simple ideas and strategies to help lower your financial pressures today or lower your stress levels about your financial pressures so that you can do what's best for your family and take care of them in the future. So take care. This has been Mark Solomon, your special needs financial guide. You have a blessed day, and we will talk to you again real soon. Take care. Bye-bye.